Welcome, everyone. I have a special guest today, Sue Schade from the University of Michigan, who is the CIO there for the health system. Sue has been a great, I would call her mentor. I follow her blogs, I follow her tweets, I follow everything that she does in terms of getting some great ideas, whether it relates to leadership, healthcare IT strategy, mentoring. So I'm really privileged to have Sue with me today. Um, Here you go, Sue. Please just give the audience a brief introduction about yourself, your organization, anything you want to share.
Sure, sure. First off, thank you. And to say that I'm your mentor, David, I think it's mutual. I follow a lot of what you post around technology and innovation, which is pretty leading edge and interesting. So my pleasure to do this today. I am the CIO for the hospitals and health centers here at the University of Michigan Health System. I've been here now for the past 2.5 years, and prior to that, I was the CIO at Brigham and Women's Hospital in Boston, part of the Partners Healthcare System for almost 13 years. University of Michigan Health System is 3 hospitals, about 1,000 beds. We're part of the University of Michigan and have pretty much all the same challenges that other CIOs and healthcare organizations have, and the particular challenges of an academic medical center. So we can get into anything you want in the next few minutes.
Perfect. Well, I'm pretty sure one thing that's on top of everyone's mind is what is your top priorities? I know, sales always have their top four. If I were to look at, what's going on in terms of your role at Michigan and your personal attributes, what would that be, your top four priorities?
Sure. Sure. So the top focus areas that I spend time on are our continued journey with our EHR. We have Epic. We've rolled out revenue cycle, ambulatory, and inpatient, and we continue on that journey with some of the specialty departments next. Another area that I spend a lot of time on is our health information exchange within the state and just interoperability, whether it's working through the HIE here, which is Great Lakes Health Connect that we use, or whether it's leveraging the Epic suite for other client organizations to go direct. So that's been a big area of focus. Another big area is analytics. We've developed an enterprise analytics roadmap in the past year. And when I say enterprise, that's at the health system level. So it includes both the medical school as well as the hospitals and health centers, trying to get us out of the silos and really working on one integrated plan around analytics. Another area is security and trying to strengthen our security program. We're in the process of hiring a health system level CISO. So that's a big focus right now. And then I would say just within the department, running the department, trying to make the department as efficient as possible and applying lean methodologies to the work that we do. So those are kind of key focuses now. Some of the stuff coming yet is to strengthen our telehealth program. We're looking at some things in terms of care at home and how we might leverage technology there, and making sure that we're supporting the population health efforts and increasing efforts around patient engagement. So that list is probably a list similar to yours and similar to most of our CIO colleagues.
Yeah, great. It doesn't sound like that's too much on our plate, does it?
No. Oh, we're going to do ICD-10 this year finally.
Oh yeah, that's right.
What about that?
One thing I want to ask, just from I think from a selfish standpoint, related to HIEs, how are you guys tackling that? Are you going towards one consolidated HIE for the entire state, or do you see many HIEs popping up in different regions that's trying to maybe work together, or maybe not?
Sure, just briefly, and I think every state and region is different, but the state strategy here several years ago was to have sub-state HIEs that were in particular market areas. That didn't play out so well. Two of the biggest ones ended up really going across the state and competing. So what we did a year ago was to merge those two large ones into one, which is Great Lakes Health Connect. So we have participation from organizations that represent 80% of the beds in the state, so that's pretty big. The other sub-states exist in smaller markets, and then we all connect in with the true state level one, which is MyHIN, Michigan Health Information Network. But provider organizations, physician practices connect in to those sub-states then connect into MyHIN. And I think we've done fairly well here. I talked about that in my blog 2 weeks ago in terms of interoperability, the challenges around the country, and what we've done here. So I think we're making progress.
Yeah, I think we're all in the same boat trying to get that consolidated single view of a patient record. I think that's the ultimate goal for everyone.
Right.
let's shift a little bit. I know we always talk about things that we're doing on a daily basis, but one of the main roles I view as a CIO is leadership.
Mm-hmm.
Lots of leadership styles. I'd
Mm-hmm.
love to hear about what is your style, what is your thought process on how to be a great leader.
Okay, how to be a great leader. Well, I try to be a great leader. I think a couple of things. One is make it very clear what your values and guiding principles are and what's important to you. That your staff knows that you live that, you breathe it, you walk it, and you demonstrate it in everything that you do. And I did that when I first got here, talking about teamwork, customer service, accountability, transparency, process improvement, having a results focus, and focusing on innovation. Those are the key points that I shared with them, emphasized repeatedly, and want to make sure that we're addressing appropriately. I think just being an authentic, who you are as a person. I think people like to know leaders and something about them, not someone aloof up there, but you're a real person. You've got challenges. You're working to make things better and to move everybody forward. I think being open and accessible is really important, and I guess that goes somewhat with the authenticity. So there's all sorts of things in terms of balancing strategy and operations and building the relationships and being forward thinking and vision that come with it as well. But those are some of the key points I'd emphasize.
Mm-hmm. Well, great points. From a young leader standpoint, I would love to hear some of your thoughts on some of the things to best practices, things, lessons learned, tips and advice that you would recommend for young leaders watching this, watching the show.
Okay, young leaders. Okay, first off, I have a lot of years in management, like 30 years. So I have been around, seen a lot, gotten the scars, learned from my peers, learned from my mentors along the way, and I learned from my staff as well. Having somewhat of an adaptive style is important. You have to have a level of flexibility. You can't go into situations my way or the highway, my way or no way, and being really rigid. There's a lot of negotiation, consensus building that happens for leaders, especially in large complex organizations like academic medical centers. I'm sure you know that. I think it's important for young up and coming leaders to think about having a formal or informal mentor. Look for someone who's ahead of you in their career path, but on the path you want to be on, who you see as a role model and may be willing to give you some time. So I think, what else would I say in terms of lessons? Wow, have self-confidence and just really be true to yourself and have a high degree of integrity. That's really important. One of the most important things that one of my bosses said to me many, many, many years ago, and it still sticks with me, is always do what's right for the organization. So when you're stuck in politics or you're wondering if you need to raise something or try to make something happen or address an issue, think about what's the right thing to do for the organization.
Yeah, great tips, great things I'm gonna take on and apply them personally as well.
Okay.
The other thing, I know you're really big on promoting women in healthcare IT, women in leadership. What are your thoughts on that? Some stats I've seen, Silicon Valley is where you really hardly see any women leaders in healthcare, or for women in IT.
Right.
To hear your thoughts on how do you promote that brand? How do you get women more excited about working in a technology field that's traditionally dominated by males?
Sure. So let me just give you a stat. I pulled out something that I'd written before. So one stat is that in the STEM fields, women make up just 26% of the science workforce, which is only up a little bit from 1990. So we're not moving very fast on that. And today, only 18% of undergrad computer and information science grads are women. And in '84, so that's 30 years ago, there were 37%. So we've dropped since that time. So I think it really is important to pay attention to those numbers and figure out what we can do about it. So a couple of things. I think we need to start them young. So, promote, take your, daughters and sons to work day. Support and encourage programs like Girls Who Code. Connect to local organizations. The one we have here is Michigan Council on Women in Technology. As leaders, I think we need to get out, talk about the issue, and that we need to encourage more girls to go into the sciences and technology. And actually demonstrate our openness to that through support of those programs as well as internship programs. I think that's important. And you really can't start too young. And one of the slides and stories I tell in a talk I've been doing to a couple different groups around this topic, I talk about my 2.5-year-old granddaughter who loves robots. She was calling them bobots at one point, and also loves dance and Princess Sophia and all those girly things. But her parents are balanced and trying to encourage both those things. Her mother actually drew a picture of a ballet robot on her little leotard. And the question I pose to audiences when I do this talk is, how will the social order affect this young girl when she gets to a certain point in school? Will she be encouraged to think about sciences and her interest in robots, or will she be discouraged? So having an open, encouraging environment for young girls, I think, is really critical.
Yeah, that's great, especially for someone like myself who have 3 daughters. I'm
right.
Going to take those advice and tips to see how I could get them more well-balanced versus just loving the My Little Ponies.
My Little Ponies and princesses, right?
Yeah.
Robots in there, David.
I know. Maybe I'll take them to work one day as well. Do the Daddy Day at Work with Daddy initiative.
Yeah. We had a great program here this year on Take Your Sons and Daughters to Work Day, and one of our desktop folks did a whole thing on inside a computer, and the kids were just fascinated by that.
Actually, that's a good idea. Do you think that really promoted a better culture, just the camaraderie between the departments by having them a day of bringing their kids? You think that really?
I think it does. I think it does. And that reminds me, one thing I didn't comment on is we as leaders need to make sure that we have supportive cultures. That we, you hear about bro culture and in technology and maybe in Silicon Valley and the startups in particular, but we need to make sure that we have a healthy supportive culture for men and women, a very diverse group of people in technology, and I think that will go a long way too in encouraging girls to get into the field and stay in the field. You still hear a lot of stories. I can't believe in 2015 I'm hearing.
Yeah.
Like bad stories, right?
Definitely, that's a great idea. So I'm gonna steal that from you. So anyone listening from the University of Mississippi, when we do a day at work with your parents, that really came from Sue in Michigan.
Good. We can send you our playbook, some stuff we did.
Perfect. Well, one last question that came from the Twitter stream that's on top of all our minds as technology matures. We hear about Internet of Things, sensors, wearables. How do you see that play out, and how do you see that even integrating with the enterprise, your enterprise application, whether it's an EMR, your enterprise radiology system? How do you see that play out in the future?
Sure. So I have no crystal ball, but I think that the demand is going to continue to grow. We're all collecting a whole lot of data with our Fitbits and our different devices and sensors. Only certain information on certain kinds of patients with chronic conditions, I think, what physicians actually want to see. So we need to have ways to get that easily into the EHR record. We're working on something right now along those lines, some basic stuff. And we're also doing doing a look. A faculty-led group here has looked at care at home and how we can potentially leverage technology, which I think is very much the wave of the future in terms of doing more care in that kind of setting where it's appropriate. So we're going to have to figure out how do we get feeds in from various kinds of home monitoring and remote sensors directly into our EHR, so it's integrated and not a whole lot of one-offs. I think probably the industry right now is full of startup technology companies that are doing a whole lot of one-off stuff. We're going to have to figure out how to get that more integrated, but it's going to happen.
Yeah, can't agree with you more. Well, I know we're running up on our time. Sue, thank you very much for your time and the insight, and I'm just glad I'm able to get some ideas. Thanks, everyone, for joining us.
Thank you very much. My pleasure.
Take care.
Bye.